Thank you everyone for coming and welcome to this workshop. It's really great to have you all here. So this is a joint event held by the Wellcome Trust, the Lancet and our Race and Health group at UCL. And our plan for today is to provide you with some information, but more importantly, to hear from you and for you to talk to each other. So we've tried to bring together different kinds of people. You've all been handpicked to come here to this event. So we have funders, we've got academics, we've got activists and NGOs, and we've got publishers all together in a room. And we're hoping that you're all going to talk to each other so that the important people here can learn from the more important people here. So my name is Deivanayagam. I'm a professor of global child health in UCL, in the Institute for Global Health, the lead of Race and Health and the Envisioning Environmental Equity project that we're going to talk about today. The World Health Organization describes climate change as the single biggest threat facing humanity. Climate change affects all of us, but not all of us equally. It generally, the people who've contributed the least have the biggest impact from climate change. These are usually the people who live in the poorest parts of the world, minoritized populations, young people who face profound impacts from climate change. We've got two presentations from two stellar academics from UCL. Dr. Marina Romanello is the Executive Director of Lancet Countdown in UCL. Her research background spans toxicology through to environmental health and climate change, and she's previously carried out research in the Instituto Tecnológico Buenos Aires, the University of Cambridge, and the Francis Crick Institute. Marina's first going to talk about, to give an overview of Lancet Countdown's work, describing the health impacts on climate change. We then have Dr. Deivanayagam, who's a public health registrar and academic clinical fellow from the University of Lancaster and is part of our Race and Health team, who led a review paper that's just been published in the Lancet last night. So Abby's going to talk about that work, and then afterwards we'll have about 10 minutes or so to take questions before we move on to the second part. So Marina, over to you.
Hi, everyone. It's great to be here in a very, very important event. Thank you so much, Dylan, for the introduction. As Dylan said, I'm the Executive Director for Lancet Countdown, and I'm going to tell you a bit about what the Lancet Countdown is. I'm going to walk you through our data. We're very data intensive, so you'll see a lot of graphs on the screen. But what I'm going to try and do, and if everyone ever heard one of the talks of Lancet Countdown, I'm going to make something a bit different that is focusing on what it means for inequities and what our data does or does not show in terms of justice and inequities. So hopefully you've seen the slides already, then it's not a repetition. So the Lancet Countdown is a big international organization. We work with now over 50 partners around the world, mainly UN agencies and academic research institutions. And we have over 300 people contributing to the broad Lancet Countdown through the global team that I'm going to tell you a bit about now, and through regional centers that I'm also going to go to that in a moment. So the work that I'm going to present to you is actually the joint product of the effort of a lot of people that work every year to produce indicators that the Lancet very generously publishes every year. It's a big push. So we thank Richard, particularly there, that's looking at me, for the volunteer team of the Lancet. We know we ask a lot of you guys. So we publish these reports annually in the Lancet. We publish them just ahead of the COP climate negotiations of the UNFCCC. And in this report, we have over 40 indicators looking comprehensively about every aspect of the interaction between climate change and health. We look at the health impacts of climate change. We look at the action that's being done in terms of protecting health through adaptation in health and health-related systems. And importantly, we look at mitigation, what that means for health, what are the health co-benefits of mitigation. We look at the economic transition and at whether social actors, political actors, the scientific community, and media are understanding that when we talk about climate change, we're fundamentally talking about the most important health threat of the 21st century, and that climate action could be the most important health opportunity of the 21st century. So a lot of data. I'm going to show you some of the key bits of data today. But before going there, just to set the scene, I know you probably all know about this because that's the reason why you're here. This is an old slide from the 2015 Lancet Commission on Climate Change and Health. And I like it very much because it shows us that climate change is affecting our health through many different routes. We have direct impacts of climate change on health through direct exposure to storms, extreme weather events, extremes of heat, floods. But all of those changes in the environment are also affecting the natural systems that we depend on, and are affecting, for example, our water security or food security, are affecting the ecologic suitability for the transmission of infectious diseases. We're seeing dengue spreading, malaria spreading, and other vector-borne diseases in new latitudes and putting more people at risk. We're seeing land use change also affecting climate change, and at the same time interacting with ecosystems, with biodiversity, putting our health at threat as well. But the important thing is that all of those direct and indirect impacts of climate change on our health will be always sieved by social dynamics and socioeconomic contexts. It's not the same responding to a climate threat when you're in a high-income country with a health system that protects you with good infrastructure than when you're in a low-income country where you perhaps don't have access to local healthcare, where the infrastructure can be poorer, or if you're a person that lives with an underlying health condition and therefore are extremely vulnerable to the health impacts of climate change. Or if you're an underserved community, if you don't have access to the health systems that you need, if you've been socially isolated, etc. So when we think about the health impacts of climate change, this is not only about the climate. This is about the climate and how it interacts with the social and economic systems that we depend on. Again, this is a very old one. This is from 2009, but I think this is the most graphic picture of climate change and what determines the state of the global climate negotiations today. In the maps that you see on your left, you see the sizes of countries that have been distorted to represent the tons of carbon dioxide accumulated in the atmosphere from those countries. And you can see that disproportionately, it is the US, Europe, that contributed the most to the accumulation of greenhouse gas emissions in the atmosphere. That's something that we all know. And in the bottom one, you see countries distorted by their mortality per million population, a reflection of access to health, of well-being, of prosperity. And you can see that those two maps are almost the opposite to one another. And this is roughly what climate change and health looks like. We have high-emitting countries that have contributed the most to the climate crisis, that are now doing a lot of progress in terms of decarbonization. And you have low-middle-income countries or more underserved populations that are being disproportionately impacted by a climate crisis that they contributed little to. And what happens is that when we have a climate threat, it impacts on the most vulnerable communities the most, leaving them in an increasingly vulnerable situation. So next time that they have a climate threat, they're most affected as well. So that's a positive feedback loop, and that's kind of the positive feedback loop of health inequities and climate change. So going a bit into our data and how we're trying to untangle this. One of the first things that we think about when we think about climate change is heat exposure. And even something as simple as heat exposure has a lot of inequities that underpin how heat will affect our health. People living with underlying health conditions, the elderly, the very young children under 1 year of age, those that don't have access to care, those that are socially isolated, will be disproportionately affected. And that's what we see heat wave after heat wave. Generally, the most isolated people, the elderly, are the ones that are the most affected. But here we do something very simple. Here we just monitor the number of heat waves, and we monitor population, and we see how people over 65 years of age and very young children are being affected by heat waves. And we see 3.7 billion more single exposure events of these vulnerable communities to heat waves today than in 1986 to 2005. And you can see in the graph how this is rapidly increasing and how, by and large, this is because of the changing climate, not because of demographic changes. So vulnerable communities at increased risk because of climate change and the incidence of heat waves. But something that is perhaps more interesting is that this is not only about direct physical impacts. When we look at the changing temperatures, we know that it's very difficult to do physical activity when it's very hot. We know that people need to take more breaks, have water breaks, shelter. And we know that as a result, labor productivity goes down when temperatures increase. And what we're monitoring here is the loss of labor productivity in countries that you can see on the right-hand side that have been stratified by Human Development Index. This is an index that takes into account economic performance by GDP, life expectancy as a proxy for health, and education, also years of education as a proxy for education in the countries. So it's a complex metric that takes into account many of the different key aspects of what we call human development. And what we're seeing is that globally in 2021, we saw about 470 billion hours of potential labor being lost as a result of heat exposure. This is almost 40% increase from the 90s. But when we look at how that is distributed in different countries of different human development index, what we see is that low and medium human development index country disproportionately see hours of labor lost in their agricultural sectors. These are agricultural workers that cannot take shelter because labor in the agricultural sector happens outdoors. Generally, they're amongst the most poor in each of these countries. And generally, the food security of those countries depends on these workers. So the ramifications that this has are enormous. People are losing income. We're estimating about $700 billion being lost every year as a result of the loss of labor capacity. And again, in the low human development index, about 82% of all those losses happen in the agricultural sector. And this amounts to about 5% of their GDP. So the implications of that to their economic well-being, their prosperity, their income, and the socioeconomic determinants of health are enormous, way more than what we see when we look at the death figures from heat waves. Looking at droughts, I'm going to go very quickly through this one, but one thing that is really interesting is that when we look at the impact of droughts, if you look at the map that I'm showing you there, the incidence of droughts is increasing disproportionately in very vulnerable areas of the world. We see it in Africa, in the Horn of Africa. The drought that they're experiencing is a record drought, pushing millions to the brink of famine, and this has been linked to climate change. So again, generally areas where they have little resilience to these drought events. And linked to that, we're seeing food insecurity and undernutrition increasing. Once again, it will increase disproportionately in those areas where people were already at the brink of food insecurity and malnutrition. So in the most underserved communities, in the most vulnerable parts of the world, you have climate change that pushes you just one bit further. And what we're seeing is that as a result of the increased incidence of heat waves themselves, we're seeing 98 million more people self-reporting food insecurity today than we did in 81 to 2010. So we're seeing the direct effects of the rising heat on food insecurity. And this obviously now happens in a very complex international situation in which we're having disruption of supply chains, we're having unprecedented droughts in South America, in Africa, and we're having also a cost of living crisis globally that is making things so much more difficult to many, many families. And finally, I talked already about infectious diseases, but I think this is quite interesting. We're seeing some of the infectious diseases that most affect the most vulnerable parts of the world, like dengue, malaria, cholera, spreading as a result of climate change, undermining control efforts. And we've been hearing over the past month that we've been working with some organizations working in Africa, how they're more and more seeing malaria, for example, in highland areas, where generally people were quite protected from malaria. Now they're being affected by malaria. And the health systems are becoming overwhelmed. Despite the enormous control efforts and the progress that has been done over the past years, we're seeing more and more cases of malaria higher up and further in northern and southern latitudes as well. In dengue, the fastest spreading vector-borne disease, we know that climate change is one of the key factors that is affecting dengue. In Argentina, where I'm from, in Buenos Aires, we're seeing an unprecedented outbreak of dengue. Our health systems are now overwhelmed. And the worst part of all is that it's starting to affect areas where the health systems are not prepared to diagnose, identify, and treat dengue. So it's spreading so much more as a result. So that is kind of the climate signal mostly. I've been talking to you a lot about climate signals and what happens as a result of exposures. But perhaps the most concerning thing here is that we're seeing that in our response and our capacity to prepare to cope with these pressures to the health, to our health, countries are not quite adapting as fast as they should be. And what I'm showing you here is the implementation of the international health regulations for pandemic preparedness, detection, and response, in which countries need to implement systems to be able to control disease outbreaks in an internationally coordinated manner to prevent something like, for example, a COVID-19 pandemic or an outbreak of dengue or an outbreak of malaria. And what you can see there, once again, is countries stratified by their Human Development Index, from left to right. And once again, there's a very clear ladder. Countries with the lowest levels of Human Development Index are lagging in the adoption of these health protective measures and the capacity to strengthen their health systems, whereas countries with high Human Development Index are implementing these measures so much more. And this is mostly, as self-reported by countries, due to a lack of financial and technical resources in low and medium human development index countries. So they're not only being disproportionately affected by a crisis they did not contribute much to, but they're also disadvantaged in their capacity to prepare and respond. Very quickly, same thing here. This is showing you the implementation of early warning systems to different critical diseases. And I'm not gonna go in detail into this slide, but what you can see is inevitably the same thing. From left to right, you're seeing from the low to the very high human development index countries, always the same ladder. But this is not only about adaptation and our capacity to increase resilience. And this is something that I think is very important for us to realize. In general, when we talk about climate action, there's this global understanding that low middle-income countries need to adapt, high-income countries need to mitigate. But I hope I'll convince you that that is leading to increased inequities as well due to that unequal response. The global carbon intensity of the energy system has decreased by less than 2% since the year that we all agreed to limit global warming when we signed the UNFCCC in 1992. Less than 2%, we haven't really done much. The worst part of all is that we've increased our energy consumption, so we're reaching record emissions year after year. But here, perhaps the most interesting thing is if you look at the graph on the right, that shows you the proportion of electricity from renewable energies in each Human Development Index country group. And what you can see there is that the very high Human Development Index country group is leading the adoption of clean renewable energies. It's producing much more of their electricity from clean renewables. Now about 10% of the energy grids of very high HDI countries comes from these clean renewable energies. Whereas if we look at the low Human Development Index country, they're lagging behind massively. We have about 1% of the total electricity in low Human Development Index countries coming from new renewables. And what that means is that because we're developing mitigation strategies in high Human Development Index countries, those in low Human Development Index countries are not being really given access to the resources, although they have the natural resources like lithium and cobalt, but not the technological resources to be able to develop these technologies. And what happens is that those countries are still A, dependent on fossil fuel markets, which are really volatile. We saw what happens when we have disruptions in fossil fuel markets. And B, still using dirty fuels in their homes, still dependent on biomass and of highly contaminating sources of energy. So when we look at what happens inside people's homes, here is where that inequity becomes really clear. About 70% of the global population only has access to clean renewable energies, and this is just for cooking. But when we look at low Human Development Index countries, the proportion falls to 13%. If you look at the graph there, again, you see a very, very clear ladder. In the adoption of clean energies for cooking, low Human Development Index countries are really lagging. And that means that in the 62 countries that we've analyzed, mostly belonging to the low and medium Human Development Index, the air quality inside people's homes exceeds the level of PM 2.5 recommended by the WHO by over 30 times. So people are still dependent on highly contaminated fuels, have low access to electricity, high levels of energy poverty that impacts development. And all of this could be avoided if they were given access to clean renewable energies that are off-grid, decentralized, and locally produced. And the WHO has done a really interesting case study where they've been helping health systems in sub-Saharan Africa get access to renewable energies, improving their energy delivery and their healthcare delivery because they have provided them with renewable energy technologies. But it's very important that that is developed in-house and that when those technologies are developed, they don't simply replicate the international dynamics of the capital and the know-how being held in high-income countries and low-middle-income countries having to always go knocking at doors, asking for lending, asking for access to technologies, or having to hire a company from a high-income country to come and develop that technology locally. So that is kind of what our indicators show us. And I think we always try to make the case that we need to increase access to clean renewable energies in low-middle-income countries. We have a lot of evidence in the world divided by high Human Development Index and low Human Development Index, but I haven't really spoken to you about race, about gender, about any other types of inequalities that we know are highly affected by climate change. 2 years ago, we tried to look at our indicators through a gender lens. And we asked ourselves, how many of our indicators can be disaggregated not even by gender, just by sex, even if just by sex. And although we went systematically through each and every one of them, tried to look for new sources of data, we only could do that for 4 indicators out of the 44 that we had that year. None of them could be disaggregated by ethnicity, by race. The only achievable breakout that we had was by HDI or income group, and that's a geographical breakdown. It's not even per person. Our indicators, as I've shown you, very few of them capture impacts. And if you don't capture impacts, and if you don't have data disaggregated by these different conditions, then you cannot quite capture the inequities in the manner that you should to be able to address them. And perhaps what is a bit more concerning is that even in our authorship, we have a big skew. Only about 12% of our authors come from LMIC institutions, or came last year. We're increasing that. And about 20% were LMIC nationals, many of them working in high-income countries. But we have a big skewing of where the data is being generated, how it's being generated, and which type of data we capture. And we've been working with different organizations, including UN Women, to try to disaggregate data by meaningful metrics that would allow us to capture inequities, but it's still incredibly challenging to be able to even capture all of this information. So the data gaps and the gaps in scientific information are enormous. But it's really important that we also incorporate LMIC researchers into the way that we are delivering these metrics and this data. So in an attempt to do this, what we're doing at Lancet Countdown, and you might have heard of this, is we have different regional centers being opening around the world, trying to increase the capacity to produce data and metrics in ways that are locally relevant across different world regions. So we're hoping that we can at least start galvanizing different research communities to start looking a bit closer at climate change and health, seeing what's important in different world regions, and trying to increase also the representation in our authorship. We think is a crucial factor to be able to even start developing the data that is necessary to capture all of these problems. And with that, I will just close, and thank you very much for your attention.
Good afternoon, everyone. My name's Deivanayagam. Really pleased to be with you all here today. Thanks so much, Marina. Where are you, Marina? Oh, there you are. Thank you so much for that overview and for all the work that you do with developing indicators year after year after year after year. Yeah, so important, and wanted to reflect especially on how difficult it is to capture in an indicator the amount of injustice that's happening around the world when it comes to climate change and health. What I'm going to say today is not groundbreaking. The work that we've done at EEE with our amazing collaborators is not revolutionary or new. We're very much building on the work that has been done for years and years, and especially work that has been done in research and grassroots and community movement spaces for decades. And before I go any further, I'll start by honoring those that came before me, acknowledging how wide and deep this history is, and honoring our ancestors, my ancestors, who have protected and defended land which is now extracted to generate capital. I also invite us all to pay a moment of respect for those who have defended the earth and the land and lost their lives defending it against discriminatory policies all around the world. And these are people who have been executed by the military, by the government, by companies pursuing profit. And these are people who have been resisting systems that cause what we see as the health impacts of climate change. And these people have campaigned and given their lives for the well-being and health of the planet, for ecological health, for us to breathe clean air. And I invite you to take a moment to honor the people not only who have come before us, but the people who will be coming next to continue this work that we're doing on justice, on health, on liberation. This work on racial justice is not just an add-on for us to think about or an angle for us to take. Justice must be our starting point. And we're so proud and thankful for this piece of work to be published in the Lancet yesterday. Thank you so much to Pam, especially. Thank you to Richard and everyone else for us being able to put research out there that is able to tear open and lay bare the violent structures that fuel climate change and its consequences for human health. Why is it so important for research like this to be out there? Because it paves the way for what is really transformative action in the field of health. So thank you once again so much to The Lancet for giving our work a home and for giving our work credibility. And thank you to Wellcome for supporting this work as well. It's been a really long and tough process, hasn't it, Pam? Thank you, honestly. But here we are today. Climate justice. So climate justice is not, climate change itself is not an abstract issue. It's not an accident. And we know this. It's the same forces that maintain racism and discrimination are what maintain climate change in the first place. And in our paper, we say, and it's in The Lancet, that says climate change is ultimately an effect of the economic system, capitalism, which seeks to cheapen resources, labor, often through process of extraction, violent destruction of land, and which is historical and ongoing. And these processes are processes of colonization, dispossession, and coercion. And the wounds that result from this injustice are incredibly deep for communities, and it runs across generations. And climate justice means acknowledging that taking advantage of the planet almost always goes hand in hand with taking advantage of the most minoritized people in the world, everywhere. And climate justice is not just about lowering emissions. It involves focusing on human rights in solidarity with people and communities that are most affected, promoting ecological unity of all species. And climate justice must grapple with notions of coloniality and debt. It's about building a world that is fundamentally different, valuing people and health over economic growth and profit. And it's not about reforming the current system and making it more sustainable. It's about building something different and new, embracing multiple knowledges, including Indigenous knowledges. And this is our starting point as EEE. Climate justice as racial justice is our starting point. So this piece of research is an offering from our collective of mostly academics and activists, as well as young people who work also at the grassroots. Quick note on language and terminology. So in our work, we use the term minoritized, and building on many other explanations, we define minoritized as individuals and populations, including numerical majorities, whose collective power has been eroded through the targeting of their identity. And the fact that it's minoritized and racialized suggests that it's an active process. And we focus on these different forms of discrimination at EEE and Race and Health. We focus on discrimination based on caste, ethnicity, indigeneity, migratory status, race, religion, and skin color. In our paper, we could not study gender, class, or disability, or other forms of structural discrimination, but we did study about how they intersect with some of these forms of discrimination. A little bit about our paper. So our paper has three main aims. The first is to show how the unequal impacts of climate change due to racism, xenophobia, and discrimination occur. The second aim is to highlight unequal responsibility for climate change historically between countries, as well as the health burden based on this responsibility. So Marina showed you a map where different parts of the world were squeezed and other parts of the world were expanded. So we've got a series of maps that highlights that alongside different health and mortality indicators as well. But as Marina said, a geographic analysis only gets you so far. It completely obscures inequities that are happening within countries. So therefore, our third aim is to show the pathways through which climate change, health, and racism interact in the most affected areas for the most affected peoples. And this cannot be done through indicators. This can be done through stories, through case studies, through testimonies. And that's what we do in our paper. So this is a novel paper, I think, using multiple different methods, including a scoping review, case studies, geographic visualizations, a policy analysis, testimonies, but we also offer some principles to guide action, as well as some research priorities in the field of this nexus of climate change, health, and discrimination. I'll just run through some of our findings very quickly, but what happens? What happens when these three things intersect? We know that racism kills individuals. We know that climate change kills individuals. And our scoping review shows that racism, discrimination, and xenophobia interact with climate change to worsen existing harm on health and cause premature death, as Ruth Wilson Gilmore says, and widen inequalities in minoritized communities. So this affects individuals, it affects communities, but it's happening everywhere, all around the world. And we use the race and health model, which was published in The Lancet in December 2022, to illustrate the findings of this scoping review, which places separation and hierarchical power right in the middle. It's in the core. What is separation and hierarchical power? Separation occurs when land is seen as separate from humans and ecosystems. Separation occurs when certain humans are seen as separate from other humans. What's hierarchy? Hierarchy occurs when the land is seen as inferior to generate capital. Things are extracted from the land because it's seen as inferior. And hierarchy also occurs when minoritized people are deemed less important, more disposable than the ruling classes, companies, and more powerful communities. And all of these other layers in our model represent the systems and institutions in which discrimination occurs. And cutting across all of these layers is intersectionality. And this is, as you know, it's where different forms of discrimination can mitigate or exacerbate how climate change impacts on someone's health. And although the evidence in our review highlights some data from low-income settings, similar to Marina, there's very, very little data from low-income settings. It's overwhelmingly from high-income settings, which shows us nothing but epistemic injustice, so injustice in the way that knowledge is produced around the world, and the hypervisibility of certain characteristics over others. And our scoping review also highlights that minoritized voices have been excluded from decision-making spaces historically, and it keeps going now. Indigenous communities are continuously excluded from policy-making spaces and have very few protections against intrusive developments from extractive companies. And despite increasing recognition of traditional knowledges in climate adaptation and mitigation plans, a lot of the action has not occurred. It's symbolic and it's lip service, as opposed to being practically implemented on a global scale. So that was our scoping review. Very quickly touching on our geographic visualization. Why bother doing more maps? Everyone loves maps, but in our paper, the reason why we present maps is so that we can highlight how rich countries have colonized not only land, but the atmosphere itself, being most responsible for climate change. And the global north, that represents 14% of the world's population, is responsible for 92% of historic emissions above the ecological ceiling. And these are exactly the same countries, as you can see in the top on the red, that have drained $152 trillion from the global south since 1960. And as Michael Parenti says, countries are not underdeveloped, they're overexploited. When a capitalist society was created, there was always going to be winners and losers, and that's because it had a racial hierarchy. And African labor is what enabled wealth accumulation in the global north, which fueled industrialization, which fueled climate change. And that's why these links are so obvious and so violent and so bare even today. And the most recent inventions of colonialism is the fossil fuel industry complex and so many other extractive industries like fast fashion, like industrial agriculture. And these companies are still most responsible and need to pay holistically for the repair to communities. And that's why we created these maps, so that we could highlight that climate change and its driving forces cause, of course, health and sickness globally, but then these are manifesting along colonial lines today. And as you can see, and the unequal and unjust health impacts of climate change, they're only the most recent layer in a long and vast history of colonialism, neocolonialism, racism, discrimination. And what we say often as an analogy in race and health is the health impacts of climate change are simply the salt poured on very deep existing wounds for minoritized people. But what's wrong with maps? Although, as I said, they illustrate discrimination at the global level very well, but they don't tell us what's happening within countries. And this is why we have stories from most affected people in areas, MAPA. So we have stories and case studies and a policy analysis from 4 regions around the world. And what do they show? Ultimately, they suggest that this relationship between climate change, racism, and discrimination, it manifests through extractive behaviors of powerful industries, often facilitated by governments. And the case studies not only show what's happening in terms of the problems, but they show us how these communities are resisting and how they're spearheading action against some of these forces. Obviously, you know, what we can do in the 5,000 words that we have, we can't tell all the stories, and these are just a selection of the injustices that are occurring around the world and the harm that's being inflicted upon minoritized people. But I hope that you do enjoy reading the paper, specifically some of these case studies. I hope they stay with you. And we really thank our collaborators who've been amazing at writing some of these case studies. And in light of the evidence in our paper, but also in light of the global evidence, there's a very clear public health case for climate reparations. And the health community mustn't only, well, it must, of course, lobby for loss and damage funds and things like that, but it must demand more to heal, and it must demand more to repair harm, grounded in principles of reparative justice. And what is reparative justice? It can take so many different forms, from cancelling debt, from unconditional grants, to giving land back to communities. And most affected people in areas should determine what the repair and healing looks like. As Taiwo writes, reparations are not just a way to address past harm, but a world-building project for fair and ecological futures. Not only is reparative justice a really important principle, but human rights interventions are also highlighted in our paper. And as discriminatory and racist policies are enabled by our current political and legal landscapes, these kinds of instruments, international human rights instruments, can be a tool for challenging these racist policies. And we can use them to hold public and private bodies accountable for violating some of these frameworks. So, for example, the health community can back some very increasingly popular climate litigation, for example, where a lot of health groups, but not only health groups, a lot of climate groups are litigating against fossil fuel companies. That's something that we can support and back. However, when international judicial systems fail communities, and they often do, there are initiatives like the People's Health Tribunal, which provides space for testimonies from communities that are minoritized to come forward and hold some of these extractive giants in the global north accountable for what is happening in the global south. And things like the People's Health Tribunal is an example of the health community really working in solidarity with people who are minoritized in the global south. And in this case, it's our African siblings and our African diaspora. And we're really proud at Race and Health to support that work. In our paper, we have some principles to guide action. And ultimately, the health community can be a very strong voice for justice. We've done it before with many issues in the past. And what racial justice advocates and what abolitionists have taught us is that transformation is possible. And they've taught us that not only must we fix the problem now, so of course we must support initiatives that foster healing and repair now, we must save lives now. And this means that in the institutions we work for, whether that's universities, NGOs, funders, journals, we must abolish any policies that oppress. But while we're resisting harm, we must also envision, we must reimagine, we must build, and we must build what Ruth Wilson Gilmore calls life-affirming institutions. And I'm really excited that we get to do that at our workshop later. We're going to be doing some envisioning. And taking justice as the starting point could be a massive opportunity for researchers on climate change and health to join hands with people researching structural violence and racial injustice, to really transform current systems that kill mostly poor people, mostly minoritized people. We also have some research priorities to offer and share with you in our paper, and very quick summary of all of them. So we have about 7 there. And ultimately, we invite everyone to pursue research that interrogates and repairs structural discrimination. We invite you to center the voices of most affected people and areas in all your research. Quantitative research should, of course, analyze not just race and ethnicity, but discrimination. If you're finding an indicator or developing one, develop something that studies discrimination, not race or ethnicity. And then finally, also studies that have used participatory and restorative research methodologies, they've been shown to flatten some of these hierarchies. So those kinds of methodologies are also recommended. And we urge people to form interdisciplinary alliances. So people working on racial justice, people working on climate change, to come together. This work is with and for young and minoritized people. I hope you enjoy the workshop, and I hope you enjoy some of the artistic offerings like the comics and the documentary films. Their work has taught me to imagine, their work has taught me to practice active hope, and we work with them for them, and we remain accountable to them. Thank you so much.
Thank you very much, and thanks to both Abby and Marina for your excellent talks. Abby, I wanted to pick up on one point you make in your paper, which I should have been much more aware of, but became more aware of by reading a book which has had a very big influence on me by Jaime Braille. And that is the fact that we are so biased to the Anglophone literature. And you point out in your paper that that's been a severe challenge for you in how to access non-English language literature. And I just wondered if you could both reflect upon that, because how do we genuinely, in the way that Jaime Braille writes, create a kind of intercultural approach to our study by being genuinely inclusive, because we're not being genuinely inclusive at the moment. And it's not a simple task, but what strategies can we use to try and expand that linguistic inclusivity?
So I don't know if Priscilla wanted to come in here as well, as one of our collaborators from Brazil, but I think the words you use there, Richard, inclusivity. I think one of the ways that, one of the things that stood out for me from the Race and Health series in December is that inclusion and diversity should never be the end point. And I think if we keep that in mind, then hopefully we can do inclusivity in the right way. And I mean, yeah, we've struggled to do language justice right in this paper, but if we were to do it again, I think we would actively include and incorporate people from different parts of the world who are researchers who are doing work in that language, and involve them from the start in developing the review, the research questions, yeah, and doing it in a very meaningfully involved way from the start. That's what I'll say, but I don't know if you've got any thoughts, Priscilla, as someone who works in both Portuguese and English.
Thank you. Thank you for the question. I think it's very important. And I've been thinking a lot about that because I've been working with Quilombola communities and they have so much knowledge, but even in Portuguese, it's hard for us to read because of who is going to publish. So I think it's important that who has the power to publish is interested, and maybe we can think about ways that people that don't write in English can still be published for people that read in English.
Yeah, one final thing also is you might see some of those comics on our tables. So potentially disseminating that research in different languages in artistic means as well is really important. I'll reflect on something that we did a couple of weeks ago with the People's Health Tribunal. We had an infographic developed in 6 different languages, and we only had quotes in 6 different languages, and most of it was artistic interpretation. So perhaps that's one way that we can disseminate research, is mainly through art, which is a really easy way to achieve language justice.
Yeah, I think beyond what you just said, Richard, that is the language barrier. I think there's also attached to that language barrier, the big cultural barrier that comes with language and with the interpretation of language, which is quite interesting. As a non-English speaker, I struggle to translate my thoughts either way, very, very much. And the whole language, coming from South America, is interesting how the culture and the identity is so different between Brazil and Argentina, because we share different languages. And just even there, you start realizing how the culture comes with language and cultural differences come with language. But one thing that we find very difficult is to elevate the research. When we talk about climate change and particularly climate action, it relies on local and hyper-local actions often. And when we look at where those actions are happening, what health systems are doing, how people are impacted or protected from climate change, many of those interventions are published in local medical journals that are national, that are only published in local languages or by medical societies and not in international journals. And most people in LMIC countries, that's certainly true for Argentina, where we struggle a lot to publish in international journals, particularly from the medical community. They generally publish in their own society journals. And that's very, very valuable information that we're not accessing, mainly because of the language barrier and where it's being deposited. But there's no reason now with AI and with all the developments that we have. You ask ChatGPT to write anything for you. I swear, Richard, they could have written the report way better than me this year. But there's so many tools at hand to break that language barrier that I think the fact that we're still over-reliant on the English language as a main language for science today does not need to be the case anymore. And we should do, I think, a lot more in terms of elevating that local research, which is crucially important because of everything that Abby has just shown.
Thank you very much. Any other questions? Kalpi.
Thank you for 2 excellent presentations and the paper as well. I am really excited to see this conversation happening after what feels like 15, 20 years of very little movement within the climate and health space, and specifically for like Wellcome and the Lancet to put so much investment in the conversation specifically around justice and colonial history. I guess I'm interested in the conversation that was had with partners in this project around the integrity of the institutions that are European based, and what partners and communities and peoples are expecting from those institutions that have historically neglected a justice-based approach to climate and health justice.
Can I also give you one question we have from anonymous attendee online? You make a hugely important point about capitalism as a root cause of racism, injustice, and climate change. How receptive are collaborators, publishers, policymakers, funders to this overt politicization of the unifying root cause? Can we Just the last two questions to both of you before we move on.
I can address the last one first. It is really difficult. Every time you do the C word in a meeting, things shut down immediately because in general, the powers at hand, they don't want to hear anything about capitalism. And that's because they have the power. But even when you talk about decentralization of energy and energy sources, that is also faced with a lot of resistance, not only from the oil and gas giants, but also from political powers, because whoever gives you energy is the one that has the power, and we depend on it. So the whole system that sustains capitalism is the same system, as Abby says, that sustained climate change, and therefore you have to go against the powers that be. And inevitably, we really, really struggle to open this conversation in political fora. I don't know what your experience has been, but in general, it's really difficult, and you face a lot of resistance. So we had to be very careful not to shut down the other side, the side that we're talking to, by trying to frame it. And I think the health framing helps a lot, because in the health framing, you're talking about people, you're not talking about capital or power, you're talking about people, and that helps break some of those barriers. But as soon as you start talking about capitalism or even the centralization of energy, that's where the conversation often stops.
Yeah, I think, yeah, you're right, Marina. It does switch a lot of people off. But I think the role of the health worker is to have that conversation. And you can't deny that health isn't political, and it isn't ecological, and it isn't completely dependent. Like, the way that we are healthy right now is totally limited by the system of capitalism. And there's an amazing book by Adler Bolton and Veerkant, and they talk about how you have to actually remove the fact that health and capital are so linked. You have to completely sever that relationship. And we as health workers and health community, we have denormalized a lot of these structural forces in the past, and we've done it successfully with the tobacco industry. We've done it with other industries before, and we haven't done it through talking with them. We've done it through completely decimating that system and denormalizing that system. So I think I would argue that it's important to embrace health as political when we're having these discussions. Maybe with them, but if we're not getting anywhere with them, then we will push them in any way, shape, or form and with pressure, and from the ground up, because there's so much movement against these systems, and I firmly believe that we will keep these fossil fuels in the ground in our generation. We have no choice. In terms of the other question, Guppy, with regards to accountability to communities and the history of the institutions that we work with and within, I think what the Lancet and Wellcome, and especially publishing something like this in the Lancet, is it gives you that credibility and that backing to show that this is structural and this is the scientific backing against it. And some of the communities that we've worked with and young people feel that it's really important to have something like this in an extremely highly regarded and powerful journal. But then we've had some really difficult conversations as a group as well. And I think it's important as people who are receiving funding to have ethical internal frameworks and discussions to reflect deeply on what it means to work with organizations that have deep-rooted colonial history, and what it means, and I think the thing we keep coming back to is who we're accountable to. And if young people in Uganda, Brazil, and the Philippines say, yes, we understand this, but we still need this money, and we still want to work on reparations, and we want to work on repair, and we want to work with these communities, then we will take the funding happily and work. Yeah. So yeah, accountability being the main word there and thing to reflect on that's helped us at EEE anyway. I don't know if anyone else wants to come in, like Hazel. Sorry.
thank you very much to Abby and to Marina. So that's the end of the first part of the event today. We're going to close down the online webinar, so we'll just take a very short break while we do that, and then we'll